You sprang up from your bed this morning, hurriedly rush into your bathroom, take your shower, dressed up, and off you go. Because you know, as a caregiver, you are not supposed to go to work late. You have some patients who are waiting for you, who are dependent on you for that caregiving, because it's your job. That's what you do. That's what brings food to the table. It's good, even if it's not a job. But you have some elderly people who are close to you, maybe your aged mom who depends on you for caregiving, or perhaps your aged grandmom who depends on you for caregiving. That's good. But the question I want to ask you is, have you really taken time to check yourself properly? Have you really considered your own health, your own well-being? Because you honestly need to be healthy, strong enough to do the needful, to do that job, to do that work. It's not easy, because at times it requires energy. There are some times you may need to lift the person up and then walk the person to either the bathroom or toilet for him or her to ease himself. Have you really considered your own well-being? It's very important. So that brings me to the topic of today's talk, which is when a caregiver needs care. You need care. You need to care for yourself so that you'll be strong enough, to be healthy enough to do the needful, to do what you're supposed to do. To that person who is dependent on you for his or her own well-being. Okay, so when you're the first factor is when you wake up from sleep, maybe after your prayers, you need to check yourself. You know, check your blood pressure, especially if you have been diagnosed with high blood pressure. Check. Even if you have not been diagnosed with high blood pressure, as long as it runs in your family, maybe your mom is battling with it and then some of your siblings are battling with it, endeavor to check. It doesn't take much time. And as a health enthusiast, you should have those gadgets in your room. Blood pressure monitor. Should be able to have such gadgets in your room, such devices in your room. Check your blood pressure first thing first. And if it is not okay, if it's high, especially if you are managing it, take your medication to bring it to the normal level. Then next one is your blood sugar. Like I said, you should have such devices in your house. Blood sugar monitor. Check your blood sugar. Don't tell me it's not your business. Don't tell me it's not your portion. It's nobody's portion. Yes, but still endeavor to check. Yeah, nobody wants to be taken unawares. Nobody wants to be caught unawares. So check. Those are the first things you need to check first. Then if you need to take your medication, please do take your medication. Your routine medication. Take your routine medication. It's very important. Your doctor's appointment, don't joke with them. Very, very important. You need to be healthy, strong enough for you to be able to do this. Because at times you may need energy. Perhaps you want to massage on the person you're caring for. You will need energy to do that. Your fingers should be strong enough to do that. You need to apply pressure, on the particular part of the body that you are massaging. So you need to be in good health for you to be able to deliver. Don't take your own health for granted. I will do it later. I will do it later. It's not proper. Do what you're supposed to do for you to be okay. Okay? Do it at the right time. Because nobody will want to slump on the neck of the person you're caring for. As a caregiver, you now come wanting to give care to someone and you are limping, maybe because you had dislocation. That person may not really have 100% confidence in you. The person may not believe that you can deliver really. So even as you are rushing to work, make sure you carry yourself properly. check where you're matching. And a little thing can cause a very painful dislocation. I know what I'm saying. So a caregiver too needs care. Don't take your own health, your own well-being for granted. Okay? So if you're watching me, you're a caregiver here, you give care to your aged mom or to your grandmom, not even as a professional person, but at least you give care to some people who are close to you, some people who are dependent on you. First and foremost, take care of yourself first, so that you'll be strong enough to do the needful. Thank you for listening. One love.